Hi, I'm Robin Newhouse. I was chair for the session on implementation science and health system interventions. The session was fantastic. The presenters were their work was so important. First, Anthony Harris, who is a physician at University of Maryland, talked about his cluster randomized trial, and he was testing the effectiveness of glove and gown use versus glove and gown intermittent use on reducing infections in intensive care. But what he learned is, in conducting this effectiveness study, that he needed to bring in aspects of implementation science to really inform his intervention fidelity. So he had to listen to the sites, the stakeholders. He had to allow the stakeholders or the sites to tailor some of the communication strategies. He provided feedback to them. He met with them every couple weeks to make sure that the questions about the intervention was complete. But he had many, many examples that were drawn from implementation science, because what we know is when we read an article about a cluster randomized trial, very often we ask, well, why? Why did it work? What was happening, and to whom can I apply this? And so Anthony had that experience and was able to pull some of the implementation science concepts in to his study. And he talked about the importance of working with people that have that implementation science expertise. Next, Marita Titler talked about her program of research. She's had a very long and successful program of research in implementation science. And implementation science focuses on what strategies can we use to help people adopt the best evidence. So Marita talked about her studies in improving pain, in reducing falls, and other important concepts. And she presented her conceptual model that she developed based on her work with Everett Rogers, and also gave us some insight into what types of funding one can receive in the area of implementation science. And then last, Brian Mittman, who is with the VA and also is a past editor of implementation science, it closed with some insight about where we are in implementation science. It's a nascent science. We are developing. There's a lot that needs to be known. And talked about the importance of standards and context, and brought home the point that it's not enough to do an effectiveness study. One must know why does it work? Why does it work under this situation? What actually made that intervention effective?